I've seen hundreds of children with COVID illness. I refuse to unnecessarily test them. When I say hundreds of children with COVID illness, mom, dad, and grandmom got COVID, positive PCR test. I got no reason to stick a swab up a kid's nose. That kid presented with symptoms on the same day, they got COVID too. Now, children don't have a developed immune system sufficient to trigger an anaphylactic or hypersensitivity kind of reaction. So all the kids that I've seen so far that have had COVID had flu-like symptoms, the first phase of the illness. None of them progressed to the second phase. Actually, I had one, an obese child of 10 years old who was taken to hospital directly, and I'd never seen him in the initial phase. He had developed a second phase of this illness, was inappropriately treated, discharged home, had recurrence, and came back to me, I think, on the 14th day with the recurrence of all his symptoms. And I appropriately treated him and he recovered. That was the only child I've had that had had an allergic reaction. So all children, by virtue of the fact that their immune system is not sufficiently developed, will not have an inappropriate immune response post-8th day, and as such are at no risk of morbidity and mortality. Now, when we look at that, we are being given the data with a relative risk reduction. And that's why I say it's disingenuous. If no children are at risk of dying from the illness, there is absolutely no point in vaccinating them. They develop the illness, they will develop a robust, natural, God-given response to this virus, which will hold them in good stead for the rest of their lives. Even if this vaccine only influences immunity, which we know it doesn't, it's got a wide diversity of effect. Even if it only influences a child's immunity, we're not sure whether that immune influence will be detrimental to the longevity or health of that immune system over a period of time. So we should be cautious about intervening where it's absolutely unnecessary. Initially, there was talk that kids were super spreaders, that they were going to infect their elderly grandparents. None of that has proved to be true. In my town, I've managed to influence a lot of the parents in the area, and our school never closed. We had a few cases, but we never closed the school. All kids that presented with flu-like symptoms were advised to stay home, sought treatment, and were isolated for 10 days. And then they went back to school. That helped us keep away the fear. It helped education to continue unrestricted. So the school itself had absolutely no issues. Now, in the third wave, teachers were convinced that they need this vaccine. Suddenly, a month after the teachers' vaccines, we had an outbreak. Everyone got COVID, even the teachers that were vaccinated. And so we got to be considerate that we're dealing with an allergen that the vaccine causes us to make and shed. So if you're allergic to peanuts, you don't want a family member walking around smeared in peanut oil. You're going to keep getting sick every time you see him. So I think we need to be cautious. If we don't understand how these vaccines work, we need to take a step back. Stop reporting all the cases. Start reporting all the illness. There's no point telling us that we got 10,000 new cases today when off that 10,000, only 1,000 are sick. So the PCR test needs to be abandoned. That is the biggest instigator of all the fear. We need to open up our economies and our societies. We need to educate people. We need to start early treatment. We need to develop immunity testing so that people can realize that they need not be fearful. I'm pushing with a company in Germany to have a subunit IgE test developed. If I mean, you know, if you're allergic to milk, you can go to the lab and they'll do a test and tell you what you're allergic to. I mean, they tell us we're allergic to cockroach feces and the rest. I don't see the point of it. Yet we can't develop a simple test to tell us whether we are allergic to spike protein. And spike protein, if we are allergic, is the biggest predictor of risk. Forget comorbidities, forget high blood pressure, diabetes, and the rest. A bee doesn't care whether you're fat or thin or whether you have diabetes or high blood pressure. The only risk from a bee sting is whether you're allergic to it or not. Yes, your comorbidities will determine your recovery and might hamper your recovery, but they have no part in the trigger of this illness. So if we could find an immunoglobulin test that will tell us who's allergic to spike protein, we would risk stratify a lot better. So all we need is a test to see who's at risk and a test to see who's immune, and we'll fix this problem. But we need the will from the powers that be, the politicians, the research scientists, and the rest, to go down this road. And so we can return to normal. If it's normal, we wish to go back to.
Dr. Chetty, would you be able to tell us roughly at what age do you think the immune system will be fully developed?
I think from what I've seen with my patients, the youngest patients that seem to have these effects of the 8th day seem to be those, I wouldn't put an age to it, but I would say those attaining maturity. So around the age of 12, 13, 14, it seems to affect those, it starts to affect those patients, even though it is far less in that younger age group. It seems to, when I say far less, I think it might be that a younger age group is far more adapted to deal with an immune response. As you get older, your ability is not as robust to fight such an allergic process. So I think that's important, that as we grow older, the risk factors start to take a toll and start to play an important role in how we recover. Remember, you can get an old lady who can't walk, and as long as you know she can't walk and you understand her risks, you can hold her hand and cross the road safely. You can get the same old lady that can't see, or you can get a young man that can't see and allow him to cross the road without any direction, and he's at high risk. So the risk is dependent on different things. And I think we need to have understanding on the greatest risk. Everything else adds to that or takes away from it. Something that I think the understanding could have brought a lot of decrease in mortality and morbidity with this. In writing my article at the somewhere in the middle to end of the first wave, I made a prediction. I extrapolated on the science. So I wrote about the Spanish flu and what happened there and why it happened that way, and extrapolated it all the way to immunoglobulin E and where we should be doing the testing. Now, one of the predictions I made there was that in the first wave, it was being reported that people over 55 years old were dying from this illness. Now, yes, people over 55 were dying and were more at risk. But if you look at the perspective, what that showed me was that people over 55 had developed antibodies to the spike protein. That means at some point in their lives, these over 55-year-olds were exposed to something similar to this coronavirus, and those that were allergic were sensitized. Now, the first time you get a bee sting, if you're allergic, you won't react. You don't have the necessary inappropriate antibodies. But because you're allergic, your body makes the inappropriate antibodies. And the second time a bee stings you, you will react. If you are not allergic, you will not make those antibodies. So what it showed me was that there was a proportion of people that were over 55 that had these inappropriate antibodies. And it's likely because they were exposed to some sort of coronavirus before. Now, that is a bad omen in that those below 55, this would have been their first exposure to this kind of allergen. And they would have developed in the first wave, without symptoms, inappropriate antibodies. However, In the second wave, when they are re-exposed to the same allergen, those below 55 have now been sensitized, and they will be prone to having severe reactions. And that's what we saw around the globe. From the second wave, younger people started to be affected and die. They had just developed inappropriate antibodies. They were sensitized in the first wave. And in the second wave, they started to have severe reactions too. Children are not at risk at all. The children that tend to have affectation with COVID illness are those that are immunocompromised, those that are on chemotherapies, those that have severe comorbidities. Now, those children are at risk. Now, if you think of, well, let's vaccinate only the kids that are at risk. Remember that the clinical trials on this vaccine were done on an elderly population. We didn't even look at clinical trials on a middle-aged and younger population. So are you willing to expose a child that is already suffering with comorbidities or chronic illness to an experimental vaccine that was never trialed on children in the first place? I think that's ludicrous. From the adverse events, we are seeing some of the strangest things that completely negate any benefit to the vaccine itself. What we see is that the oldest patients that were vaccinated had some of the most serious side effects. But those are the patients you'd want to protect the most. So it's completely on its head. The vaccine should be protecting those at risk. And as you go down the line, those not at risk shouldn't need the vaccine. Now, when you look at clinical trials that were done with Comirnaty and those kind of vaccines on children, first of all, yes, you might have done clinical trials and shown that the vaccine shows some sort of efficacy, but that's nothing. That's much of a nothing, in that those children weren't at risk in the first place. So doing a small set of clinical trials on a few thousand patients and showing that, okay, it's got some benefit, doesn't justify vaccinating the entire planet. We have better methods to actually protecting our children. And especially trying to mandate it is a whole different story. I can't see the sense in that. My son is going to high school next year. He was invited to write an academic scholarship exam by this new private school. And he qualified. He was the only kid in his class that qualified for an academic scholarship. He was all excited about joining this new school next year. When this came out about mandating vaccines, I contacted the principal to find out what is going to be your policy for next year. And he said, well, we're going to follow the Department of Health. And they have ties with two companies here in South Africa, Discovery Health, which is a medical insurance company, and Santam, which is a life insurance company. And both of them have very quickly mandated the vaccine for their employees. So I contacted him back to say, if you're not sure what your plan is going to be, am I going to be liable for my son's fees if you change your mind next year and decide to vaccinate all the children? And he couldn't give me an answer. So I sent him a message back to say, consider this a withdrawal of my son's application to your school. I'd rather have him safe at home with me. Now, my son is going to be prejudiced simply because he refuses to take a vaccine that in all I see would likely harm him more than provide any benefit at all. This is something that's going to divide society. This is something we've found the ideal thing to segregate society. We've overcome religion and the barriers it's provided us. We've overcome race and the barriers it's provided us. But the people of the top need us to be divided and be fighting each other so we can't keep watching what they're doing. And so now they found a vaccine that will divide us right down our family lines. And so I think there's a bigger game at play here.